I'm Kelly Davis. I'm the owner of Skin Essentials Luxury Med Spa and Salon. I'm also the National Educator for Cynosure Lasers, CoolSculpting and BTL, which has the M-Sculpt Neo, M-Tone, M-Cella, and other really cool skin treatments. I'm excited to talk about laser hair removal today because I know there are so many people that have a different opinion on how it works and what it's really all about. So here is the truth about it. First of all, it is considered permanent hair reduction, not permanent hair removal. Why is that? It will not treat white, gray, or blonde hair. And so with that being said, most areas that we treat will have a little bit of white, gray, or blonde hairs. Plus also, there's still going to be the chance that the laser does not treat a handful of the hair follicles. Our protocol is we have a treatment every 4 weeks for 8 treatments. And so what we know is that hair recycles every 28 days. You have your resting, your active, and your transitional phase of hair growth. So the laser is only going to be able to destroy the hair follicles that are in the active phase only. So what we know is when we stay on top of it every 28 days, as those hairs are recycling, we are going to get a good amount of permanent hair reduction, especially after 8 treatments. We tell our patients to expect an 85 to 95% reduction, and the hairs that are left are soft and easy to manage. So if you do have any left, you can just brush them off with a razor. It really is an amazing treatment, especially for those who have folliculitis, ingrown hairs, razor burn, or you just don't want to have to worry about growing your hair out to have it waxed or growing it out to have to shave it. I personally love laser hair removal. I've had it done myself for the last 15 years, and the maintenance I do is very minimal. Another question people have is what skin types we can do. So we can actually safely treat skin types 1 through 6, which is your lightest to your darkest. So we just adjust the settings according to your skin tone and the color of your hair. It's really simple. The other thing that people don't realize is that we actually need you to shave prior to your treatment. Here's why. So if this is your skin and here's your hair follicle, so what we want you to do is we want you to shave your hair, okay? So now the hair is underneath the skin. We run the laser over the skin. It searches down into the hair follicle to find the hair follicle, and that's why there has to be pigment. That's why it has to have some color to it. And it basically takes the hair follicle and pulls it from the root. So what'll happen is here's your hair, you've shaved it, now you've lasered it, so now it's just kind of sitting there. Over the next one week to 2 weeks, it's going to kind of push its way out. We call it purging. So that's what happens. Now let's just say that you leave all your hair on your skin. So the laser is going to have to go through your hair, trying to go through your skin to try to find the pigment in the hair follicle. It's not going to work. The hair on your skin is actually going to be a barrier for that light to penetrate through. So we definitely want you to shave prior to your treatment. Contraindications for laser hair removal are tanning beds is a definite no. We don't want you to be pregnant. And then on top of that, anybody who's been on Accutane, we have you wait at least 6 months before we will safely treat you. If you're out in the sun, we can still treat you as long as you're protecting your skin and protecting the area that we're treating. We also have a supplement called HelioCare that is an internal supplement that does extra protection for any sun exposure. If we are lasering an area that you've been using retinol or any type of acid, we also ask that you pull off of that for 7 to 10 days. So we are looking forward to giving you some great results with our laser hair removal services.